as a doula, how we affect and have better birth outcomes. It is my job to effectively progress your labor holistically. And your labor is your baby's journey from your stomach to the vag. And the difference between your midwife and your OB, those are your primary care providers that are there to catch the baby.
For Black mothers, what should have been the happiest days of their lives has far too many times turned into the last days of their lives. According to the Centers for Disease Control, Black women are 3 times more likely to die from pregnancy-related causes than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and implicit bias. To help us with this conversation, we brought in birthing doula, Miss Alexa Hughes.
So a doula usually refers to a labor or birth doula. So that is somebody that is there to give you emotional, physical, and educational support. But then it's like, what do those things really look like? Of course, the emotional support, pregnancy hormones brings pregnancy emotions. During your pregnancy, most doulas usually have in their package 2 prenatal meetings. That's where you're getting that childbirth education. The physical support and the educational knowledge actually come together during the labor, how we affect and have better birth outcomes.
And one of the biggest advantages of having this birthing assistant is having someone that listens and believes your concerns. Also making sure baby has a smooth transition.
And we're always so happy to help you lower anxiety, let you know to trust your body. The symptoms that you're having is normal, or maybe you should call your provider. You're not crazy, or maybe the provider or whoever they're talking to is saying that they are crazy. And it's like, nah, sis, you need to take that seriously.
Alexa shares that the implicit bias in stereotypes can affect the type of care that we receive.
We are one of the worst birthing statistics for an industrialized or a developed country. And then unfortunately, we are the race that's doing the worst. And honestly, a lot of it is a lot of subconscious racism.
Anna Mae Gaskins, who is considered to be the mother of authentic midwifery, once also subscribed to those biased beliefs.
It really hurt my feelings though when I was like doing some research and come to find out, of course, she had her colonizer moment, saying that Black women and Black babies are dying more because of their lifestyle. You know, they're always drinking, smoking. But then as the CDC started to do more studies and looking at it, a white woman with no high school education that smokes prior to her pregnancy, during her pregnancy, still has more likeliness of healthy birth outcomes than a Black, healthy, educated woman.
Alexa says the other problem lies within us. We seek truth and treatment everywhere else.
We keep turning to outside resources outside of our culture because we have been put down and taught with our PTSD through slavery that we aren't good enough, including like our philosophies and ways that we took care of ourselves back in the day, not realizing that a lot of what white people do to take care of themselves, their pharmacology systems, their healthcare systems, came from them learning from us.
Alexa leaves us with some tips for our expecting and soon to be expecting mothers. Get a doula.
The earlier the better.
Create a birthing plan.
So you can better voice and express what you want from your providers.
Find a provider whose birthing philosophy aligns with yours.
Because I want you to be educated about it because it might become a choice.
And don't forget to plan postpartum support.
Everybody's excited about baby. Everybody comes, everybody sees, and everybody leaves. As a doula, I love the fact that I'm here for mom. That way when the family goes back or if she's feeling forgotten about, she knows that I'm still in her pocket.